Hi, if you're watching this, you've probably recently been prescribed to Novolog insulin pen to treat your type 2 diabetes. In this video, I'll address some concerns you may have regarding taking insulin. I'll also discuss possible side effects, how to manage them, and how to determine the appropriate dose you need to take. This is the Novolog insulin pen that has been prescribed to you for managing your type 2 diabetes. It is a human insulin analog that lowers blood sugar faster than your body's regular insulin. Each pen you receive is pre-filled with 300 units or 3 milliliters of insulin. I understand you must have some questions regarding this treatment, and I'll do my best to answer them. I'm sure you are wondering when you should use the Novolog insulin pen. Injections made using the pen should be made prior to each meal. You should eat within 5 to 10 minutes after your injection to reduce the risk of hypoglycemia, which is low blood sugar. The effects of Novolog will start within 10 to 20 minutes after the injection, and they may last up to 3 to 5 hours after the injection. Are you not sure where to make the insulin injection? Let me make some suggestions. Areas suitable for injection are the thighs, upper arms, abdomen, and the buttocks. Once you start with a specific area, it's not advisable to change areas without consulting your provider. The actual point of injection on the body should change every time, and they should be about an inch apart on the same area of the body. You must also have questions regarding how to prepare and make the insulin injection. Not to worry, the Novolog insulin pens make it very easy to correctly inject the needed amount of insulin. Preparing the injection means doing an air shot before each injection, because the pre-filled syringes may contain a small amount of air. Doing an air shot helps prevent injecting yourself with air. Refer to your Novolog insulin pen manual to see the instructions for making an air shot. To dial your insulin dose, you want to set the dose selector to 0 and dial the number of units you need to inject. If you accidentally dial too many, the pen allows you to dial back. For type 2 diabetes, the total daily dose should be 2 to 4 skin injections per day. Remember, you want to eat after your injection. Storing your Novolog insulin pen is very important because it can affect the insulin you're putting into your body. The device should be stored in a refrigerator, but your current pre-filled syringe can be kept unrefrigerated for 28 days as long as it's kept cool. Throw it away if it's been unrefrigerated for over 28 days. Do not use Novolog insulin pen if it's been frozen or if it appears cloudy or thickened. You only want to use it if it is clear and colorless. As with any prescribed medications, there are possible side effects that could occur with taking insulin. Hypoglycemia or low blood sugar is the most common. This can be caused by skipping or delaying meals, taking too much insulin, strenuous exercise, interactions with other drugs that lower blood glucose, and drinking alcoholic beverages. If you feel you may have symptoms of hypoglycemia such as sweating, dizziness, drowsiness, or nausea, it's best to drink or eat sugar-containing foods and drinks right away. This often stops symptoms and keeps them from getting worse. Hyperglycemia or high blood sugar can also occur when taking insulin. This develops if the body has too little insulin, and it can be caused by taking less than prescribed or eating significantly more than your meal plan suggests. A generalized allergy involving a rash that spreads throughout the body is typically an uncommon but serious reaction to insulin. Local allergies are much more common and less serious. These include redness, swelling, and itching at the site of injection. Fortunately, these typically clear up in a few days or weeks. Lipohypertrophy is also a side effect of insulin that is worth noting. This is the enlargement or thickening of the skin at the injection site that can be caused by repeatedly injecting the same site. It results in lumps and scarring of the tissue under the skin that eventually heals with time. It's best to avoid these areas and rotate injection sites until they are clear. Are you concerned about other factors that may affect your insulin dosage? There's a variety of things to consider if you are taking insulin. Do not stop taking your insulin if you become ill for any reason unless recommended by your healthcare provider. It's important to stay on your regular diet as well. Exercise may lower your body's need for insulin, and it may speed up the effect of the Novolog dose you have taken. Be sure to make your provider aware of how much physical activity you engage in. Can you use insulin while pregnant? The answer is yes, and it's extremely important to maintain good control of diabetes during pregnancy. Pay special attention to your diet and insulin regimens. Can you use insulin with other medications? The truth is you can, but you want to make sure your doctor knows if you are taking anything else. Drugs such as birth control pills may require increasing your insulin dosage, and certain antidepressants may decrease your insulin requirements. How do you determine the correct dose of insulin to take? Your initial dosage of insulin is based on your height and weight. Although your provider has prescribed an insulin regimen for you, you need to calculate some of your insulin doses. This depends on the amount of food you eat during your meals. It is necessary to calculate the carbohydrate to insulin ratio to determine the amount of Novolog to inject before your meal. A standard ratio is usually 1 to 15. This means taking 1 unit or 1 milliliter of insulin every 15 grams of carbohydrates you plan to eat. 1 unit of insulin will cover 15 grams of carbohydrates because insulin is meant to offset the blood sugar rise that is induced by carbs. Reading nutritional labels and utilizing a food scale can help measure the carbs you intake to give you this information. Thank you for taking the time to watch this informational video. I hope it answered some of the questions you had regarding insulin treatment.